This presentation complements the previous ones by providing the macro-level perspective of regional trends in rural water and sanitation and their implications for cost-effective water and sanitation programming. As the GDP of countries in the regions increased, access to rural water supply grew as well, at almost 1 percentage point per year, reaching now high levels of access. Rates of growth in sanitation were even higher, but the resulting levels of access remained significantly below those of water. These trends have three implications for rural water and sanitation programs. Firstly, programs need to serve ever smaller dispersed communities. Though comprehensive statistics are lacking at regional level, data from countries like Honduras indicate that levels of access in dispersed settlements are some 10 percentage points below those the more concentrated villages. As overall access levels in rural areas increase, ever smaller villages need to be served to get to universal access. Water and sanitation interventions in such smaller dispersed settlements often come at higher per capita cost. A review of some 15,000 rural water and sanitation projects financed by the Inter-American Development Bank found that the number of people served was the main cost driver. Basically, the smaller the village, the higher the per capita cost. And because interventions in small dispersed settlements have less potential for economies of scale and fixed costs are shared among a smaller number of beneficiaries. Such higher unit costs should not be an excuse for inaction. A series of pilot projects, supported by the Inter-American Development Bank, show that it's very well possible to carry out interventions in such settlements in a cost-effective manner, by building on pre-existing infrastructure, combining communal and individual technologies, and bundling different physical interventions in a single project. Secondly, programs need to transition towards providing safely managed services. For water supply, that means improving above all on water quality and availability. Accessibility is generally less of an issue, as pipe supplies with taps on premise are the standard in most countries in the region. However, the analysis of the 15,000 projects found that a systematic tracking of service levels prior to and after intervention was notably absent from project databases. As the regions transitions to safely managed services, it's important to make explicit what new or improved level of services is achieved through new constructions and rehabilitation. The sanitation situation provides a more mixed picture. Whereas latrines are still the predominant form of rural sanitation, countries like Ecuador and Mexico are transitioning rapidly to septic tanks and particularly sewers with wastewater treatment. The cost analysis found that sewage and wastewater treatment projects in both countries can be done at similar median cost as on-site sanitation projects, albeit with wider cost ranges. This does not mean that off-site sanitation is a more cost-effective investment, because safely managed sanitation can also be achieved by on-site sanitation with adequate disposal in situ. Rather, it shows that programs need to anticipate the transition to sewers in rural areas, which is likely to start in other countries too, and that this can happen at costs that are comparable to those of on-site sanitation. Thirdly, there is need to continuously improve cost effectiveness of rural water and sanitation programs. Though the cost analysis did not identify any particular program management approaches that were statistically significantly more cost effective than others, it did note some good and worse practices. Firstly, overcoming fragmentation. In some instances, projects were fragmented based on annual budget availability. One community, for example, saw 5 interventions in subsequent years, each time installing some 15-20 latrines, not very cost effective. Others saw more integrated approaches, doing water and sanitation at the same time, contracting interventions in bundles, and combining communal and household interventions in a single project. Secondly, continuity in project pipelines. Some of the programs incurred expenses, around $25 per person, in project formulation. Others could use the pre-existing project pipelines. Smooth operation does require continuity in the pipeline of projects. Thirdly, to budget and monitor all programmatic costs. Running effective programs requires investing in project preparation, in supervision, and capacity building. However, we found these to be planned for and tracked in a much lesser detail and not consistently across programs. this needs to improve. By taking on these approaches, we expect rural water and sanitation programs to be able to accommodate the combined needs of serving ever smaller settlements and transitioning to safely managed services, and doing so in a cost-effective manner.